So good evening, everyone. I welcome you all to the first CME on how-tos of fitness for doctors by doctors, an initiative by Indian Medical Association Akola branch. I would firstly like to invite our president, Dr. Mahendra Kardasar, to welcome all the participants and the delegates and the panelists. Over to you, Kardasar.
Thank you, dear friends. It gives me immense pleasure to welcome you all for this webinar on how to of fitness. This is an attempt of IMA Akola to define the fitness in context to our profession, make our colleagues aware about fitness, and highlight on the modules which can lead to our fitness. Today, medical fraternity workers, especially doctors, are under tremendous stress and tension as consequence of COVID pandemic, anti-social elements, attacks, administrative terrorism, worsened government health policies and systems, competition in the profession which starts right from undergraduate NEET examination to establishing as a successful practitioners. So these factors do cause stress and tension throughout our life, and it hampers our fitness. We have seen many examples around us having premature retirement from the profession, practice, and everything, as well as we have seen undue deaths in our profession. Sometimes we see the deaths while working hard in our profession, practice, as well as undue exercises or something like that. So to throw light on this, we have eminent speakers from Akola IMA who are well studied and themselves are engaged with personal fitness as well as social and psychological fitness. I welcome these all speakers and all participants over here. I can see that there are 158 attendees over here, and we expect many more to join. I welcome them all, and I hand over the meeting to Dr. Tejas Vagela. Thank you. Thank you very much.
Thank you, Mahendra Kardasar, for your kind words. So before we start, I just wanted to intro the whole session for everyone. Is the full slide available? Can you see it?
Yes.
You have to make it slideshow. Make it slideshow.
Yeah. Okay. So again, I welcome you all for how-tos of fitness for doctors by doctors. So when you define physical fitness, it's the ability to carry out daily tasks with vigor and alertness without undue fatigue and with ample energy to enjoy your leisure time pursuits and to meet unforeseen emergencies. This is what Clark described way back in 1976. So physical fitness is not just a hobby, but in fact, it is an essential aspect of a doctor who day to day works on a daily basis in terms of emergencies, as well as is a parent, is a loving husband or a loving wife, and it requires to fulfill all these different duties in various aspects. So for today's part 1 webinar, we have the how-to series, wherein we have eminent speakers, Dr. Parag Tapre, Dr. Ashutosh Dabre, Dr. Prashant Mudavkar, and I would also be joining them in all these interesting topics. I would also with this introduce the part 2, which is going to be happening on 19th of February, and where we would be defining the fitness in a very practical approach. You would look about mental training and nutrition, which is another very important aspect of fitness, by Dr. Namrata Bhagwat Madam, and an inspirational talk by one of our ortho colleagues, Dr. Indrajit Deshmukh, on his weight loss journey. For today, I have been joined by these dignitaries of fitness world from IMA Akola, I have my pleasure to first introduce our speaker, Dr. Parag Thapre sir, who is a pediatric and neonatal surgery specialist who has done his MCH and DNB from CMCH Vellore. I don't think anyone from Akola doesn't know him. If he's an endurance athlete, he must have consulted Parag Thapre sir, because he's an Ironman 70.3 finisher 3 times. He's a multiple half and full marathon finisher in the last 15 years and is very passionate about endurance sports. So I would like now hand over the talk to Parag Thapre sir.
Thank you, Tejas. Am I audible?
Yes, sir.
Okay. So I'll start my sharing my screen also. Just wait for 1 second. Can you see my screen? Okay. So thank you, Tejas, for your kind words. And I'd like to thank IMA Akola, Kardasar, and entire team Akola, IMA Akola, for giving me this opportunity. Before starting this small presentation of another 15 or 20 minutes, I'd like to have some disclaimers. First of all, though I'm not an expert in the field of cardiovascular fitness, but I will like to tell you that over the period of last 15 years, whatever lesson I learned by doing myself, I like to tell you. And second thing is just be like a swan. This is a second disclaimer. Please don't judge. Swan is a mythological story where that swan, if you mix milk with the water, it will take only milk and leave the water. So you also take whatever you like. If you don't like anything, please discard it. If you don't follow any message, doesn't matter. Please don't judge any of our today's speakers. And third is this is a compilation of many authors over the period of last 15 years. Plus, I have attended some seminars on fitness and health. And these are not my presentation or my slides. I have taken them from their permission. So this is regarding today's disclaimer. So we'll start with our how to keep our heart safe. That is a cardiovascular fitness. My flow of presentation of today is regarding cardio training or cardio respiratory training, I can call it, but in a normal parlance, we call it the cardio training. Why it is important? Why we do the cardiovascular or cardio respiratory training? Because to prevent some cardiology related complication. But how to prevent that? Because ultimately our aim is to remain fit. And as Tejas has rightly pointed out, the exact definition of physical fitness. वो vigor, वो activity रहना चाहिए, और हमको fatigue नहीं होना चाहिए at the end of our day's work. So I'll be talking few slides about regarding primordial prevention and what to do, क्या करना चाहिए, and my personal experiences, if time permits, about cardio endurance training. So coming to why, सबको पता है, हम लोग सब डॉक्टर्स ही है आज ज्वाइन करने वाले सेमिनार में. Because CAD is coronary artery disease is a major health challenge. It is 1/3 of our total death in India. They are due to circulatory disorders. And this is all because of our lifestyle changes plus economic development. We are a country of 1,000 festivals. We have so many festivals, and we have a fasting followed by feasting. So there is an important thing about our dietary habits also. So we have a nice session next week regarding nutrition. I'm not going to talk much about nutrition, but this is very important factor about our training also. And we can see the total decline in waste about the cardiovascular disease or CAD deaths are because of aggressive modification in their lifestyle by the entire population. And अगर हम लोग देखेंगे कि after the age of 70 years, what is the likely events we are going to have that going to kill you is your heart first. If you're not going to die by your heart, then other is a cancer, and third is lung. So cardio respiratory endurance or respiratory training is very much important. That's why we are here today for this cardiac training thing. I'll talk a little bit about the prevention I'll not going to details of this functional test and anatomical test, but only one thing which is very much important for all of us, and I have done it. That's why I'm telling you, that is CT coronary angiography. At least if you don't do CT angio, at least do your CAC score. That is a coronary artery calcium score. I'll request to all participant of today's seminar, they get their CAC score. It is a matter of few minutes. You can get your CAC score by CT scan. And it has got a biggest prognostic test, and it has got a validity of 10 years. If you're not having any problem, the validity of CAC score is about 10 years. But if you have got a strong history of family history of coronary artery disease, then its validity up to 3 years. You have to repeat it after 3 years. But it has got a strong correlation with your coronary artery disease. So get your, I'll give the list of things to be done at the end of the presentation, today's presentation. But yes, CAC score is one of the very important thing in this list. Then there are some invasive tests. I'm not an expert. I'm not going to go into details of coronary angio or IVUS or OCT. So these are to know the exact blockage in our coronary arteries. Regarding prevention, there are two types of prevention that I'm going to talk. Now, I'm not going to talk about secondary prevention, but primordial prevention and primary prevention. Primordial is to block the onset of disease. Disease होने के पहले ही उसको block करना है. So disease, they'll say 0 to 25 years of age, and then identify the at-risk population. ये हमारे लिए तो ठीक है, लेकिन हमारे बच्चों के लिए बहुत important है. That's why I'm telling this primordial prevention. Those who are having strong family history, they should have a strong family history of coronary artery disease. They should have their kids, these things to be done before the age of 20 years. I have got a very strong family history. So I'll get my son's fasting lipid profile done by the age of 20. So to know the basic levels of his lipid profile. And as you know, at the birth, our LDL is 40. So those who are having the strong family history, they should aim for their LDL at least 60. Those not having the family history, they can indulge in their whatever food habits. But for the family history, they say that there should be at least LDL 60 and less. And then one more test is lipoprotein A. It is a sticky lipoprotein. It is very available in every town. In our Akola also, we have got a LPA available. Those who are having high LPA, there's a high risk of having the coronary artery disease. Then HS-CRP. These are the 3-4 things, and cardiovascular risk score. I will talk about cardiovascular risk score in the next slide. And regarding primary prevention, that is for us, like those maximum of us who are in 25 to 50 years of age, they should have their ASC-VAD score done. I'll tell you in the next slide what is that cardiovascular risk score. Those who are having, this is easily available on internet. They have got an app also. You can put your small questionnaire of some 4 or 5 or 10 questions, and they will give you the exact score, cardiovascular risk score. If it is 5% or you have to be careful. If the score is 10 or more, you have to be taking a lot of care. So like reduction in inflammation, their oral hygiene, and regarding a lot of things. But I will talk about two important things like sleep and exercise. Fragmentation and poor duration of sleep. It is very, very important thing to avoid. Fragmentation and poor duration. It is going to affect your cardiovascular health. So your diet, exercise, and everything is important apart from their fragmentation and poor duration of sleep that is going to harm you for a long term. Diet, I have already told you that Namrata madam will be talking on diet in a next session. Next week session, we'll go ahead with our exercise thing. This is what I was talking about, like ASC-VAD score, risk score. It is online, also available there. Atherosclerotic cardiovascular risk score. It is a small question. You can put ASC-VAD score, and then you can get your score in another 5 or 10 minutes. It's based between 40 to 79 9 year of age groups, and it will give you 10-year risk of your coronary artery disease. You know, everybody knows that avoid tobacco and cocaine in all forms. Treatment of your hypertension, get your blood pressure checked every now and then. And 3 important, I will not talk about too much about diet, but 3 important S, that is a low salt, good adequate sunlight, because it will produce melatonin, and it will give you the excellent sleep. That's why sunlight, because we are all clinician, we are sitting inside our OPDs, and there very less exposure to the sun, and that less exposure to sun will give you fragmented sleep or poor duration of sleep. So, and last point is sleep. These 3S are very important. As I know, DASH diet, I'm not going to go into details of this low sodium, high potassium, high magnesium, and high calcium diet, that we are going to cover it. So these are the things. So as far as risk exercise is concerned, that is a main area of concern today. For a beginner, those who are just starting, those who have not done anything, and now they are going to start their some exercise, I'll request them to just do it for 30 minutes of a day. Again, there is one thing, सुबह करना चाहिए कि शाम को करना चाहिए. So whatever time you are comfortable. We have got a nice discussion on this topic regarding morning जो करना चाहते हैं, that is the best time. जो दिन की शुरुआत तुम्हारी अच्छी होती है, all endorphins and all good hormones, they keep on like accumulating over the period of time in the day, and you start your day with a positive note. But there are some genetic predisposition जो लोग सुबह उठ नहीं पाते हैं. This is a study. I can quote the study also. Those who are not able to wake up in the morning, and those who are doing the exercise in the evening, that also is good. But do something at least 30 minutes. This is the recommendation by the cardiologist, at least 30 minutes per day. So how we are going to do this 30 minutes is at least 5 days a week. क्योंकि हम लोग busy clinicians है, तो कभी मॉर्निंग में, कभी इवनिंग में फिर टाइम नहीं मिलता है, बिकॉज ऑफ इमरजेंसीज, बिकॉज ऑफ स्लीप एंड नंबर ऑफ रीजंस. सो एटलीस्ट you should keep one day as a rest day and one day like emergency for at least 5 days a week. But don't plan 5 days. Plan for 7 days, then you can land up with the 5 days. If you plan for 5 days, then you land up with 3 days. That is my experience. So try for at least 7 days a week, then you can come for 5 days like that. You all know that exercise in any form, they will increase your good cholesterol, SDL, decrease your LDL, improves your immunity, improves your sleep pattern. नींद अच्छी आती है, भूख अच्छी लगती है. So duration is at least 20 to 30 minutes. So how I do it and how I used to do it, 10 minutes of warm up from head to toe. Anything which increases your heart rate, that will going to increase your cardiovascular fitness. जिससे भी हार्ट, सिंपल फंडा यही है जो मैं याद रखता हूँ कि कोई मसल को मुझे अगर काम करना है, तो वो मसल मुझे फ्लेक्स करना है, उससे काम बढ़ाना है. तो हार्ट की मसल को मैं कैसे फ्लेक्स कर सकता हूँ, उसका काम कैसे बढ़ा सकता हूँ? बाय इंक्रीजिंग माय हार्ट रेट. सो यू हैव टू इंक्रीज योर हार्ट रेट ड्यूरिंग दिस 10 minutes of exercise. Anything, even 10 minutes of exercise will be enough for you. 10 minutes of warm up from head to toe. सिंपल, कोई भी यूट्यूब वीडियो देखो वार्म अप का, कोई भी तुम्हारा वार्म अप चालू करो. 10 minutes of exercise which will increase your heart rate. Simple walk to start with, that is also good. But that walk should not be like you are walking in a some park or something like that. तो फिर 1 घंटा भी चले तो भी उसका कुछ फायदा नहीं होगा. You have to increase your heart rate. वो heart rate का भी मैं बताता हूँ कि how you are going to like measure. There are a number of apps are available. You can have any simple app from any wearable apps. We have like Fitbit or Garmin. Garmin has got a very good GPS. Very good. I'm not a proponent of any app, but GPS is very good with Garmin, and they got a lot of data, and they give a lot of analysis to your this thing. Like our incentives parameter is there. वहाँ पे कैसा हमें इंसेंटिव मिलता है, तो पेशेंट वो इंसेंटिव पैरामीटर यूज करना सीखता है. सिमिलरली हमारे फिटबिट हो गया या फिर गार्मिन हो गया या फिर एन नंबर ऑफ वेरिएबल एप्स है, उसमें भी हमें इंसेंटिवाइज होता है कि यस हमने कल हमारा कल का VO2 max इतना था, फिर आज इतना है, आज इतना हार्ट रेट कम हुआ है. तो दैट इज गुड इन्वेस्टमेंट. लाइक गुड शूज, गुड वेरिएबल ऐप इज अ इन्वेस्टमेंट. बाकी सब चीजों के ऊपर हम लोग खर्चा करती है, बट इसके ऊपर में किया तो योर कंफर्ट एंड योर ड्यूरेबिलिटी. जैसे हम लोग ज्यादा दिन तक कर सकते हैं, थोड़ा सा पैसा भी खर्चा होता है, तो हमें लगता है नहीं हमने पैसा खर्चा किया तो हम लोग अब उसका यूटिलाइज करना चाहिए. एंड 10 minutes ऑफ स्ट्रेचिंग, लाइक 10 minutes ऑफ वार्म अप, 10 minutes of exercise and 10 minutes of stretching. अगर इतना भी हमारे पास में टाइम अगर नहीं है तो क्या करना? 30 मिनट भी नहीं मेरे पास में, कुछ नहीं. सिंपल थिंग, ये तीनों भी चीज एक ही चीज में हो सकती है, दैट इज सूर्य नमस्कार. सन सल्टेशन सब होता है. सन सल्टेशन अगर 21 सन सल्टेशन होता है, 21-22 मिनट में, 25 मिनट में हो जाते हैं. प्रॉपर तरीका सीख लो, कुछ डिफिकल्ट नहीं है हमारे लिए. और सूर्य नमस्कार अगर 20-21 सूर्य नमस्कार टू स्टार्ट विथ, 20-21 पहले से नहीं होंगे, टू स्टार्ट विथ 5, गो फॉर 11, फिर 10-12-15 पे जाओ, एंड उतना किया तो उसमें तुम्हारा वार्म अप हो जाएगा, उसमें तुम्हारा एक्सरसाइज हो जाएगा, तुम्हारा हार्ट रेट बढ़ेगा और तुम्हारा स्ट्रेचिंग भी हो जाएगा। 10 नंबर सन सैल्यूटेशन, 10 वाला जो है वो सूर्य नमस्कार करो या 12 वाला सूर्य नमस्कार करो, एंड दैट इज अ वेरी गुड वे ऑफ डूइंग एंटायर बॉडी एक्सरसाइज। सो सिंपल वहां से भी शुरू हम लोग कर सकते हैं टू स्टार्ट, और देयर आर एन नंबर ऑफ मॉडिफिकेशन ऑफ सूर्य नमस्कार, वी कैन ट्राई फॉर दैट। बट जो रेगुलर वाला है जो हम लोग सब लोग करते हैं वह करना बहुत ये है। एंड व्हाट इज इंटेंसिटी, कितना इंटेंसिटी से जो करना चाहिए, जो हम लोग बिगिनर है उनके लिए मैं बता रहा हूँ पहले, और बाद में जो मॉडरेट लेवल है, एक्सपर्ट लेवल है, उसके बारे में भी बताऊंगा। तो इंटेंसिटी शुड बी 70 to 80% ऑफ योर टारगेट हार्ट रेट। उसके डिफरेंट फार्मूला है, उसमें थोड़ा बहुत कंट्रोवर्सी है, बट डोंट गो इनटू दैट टू मच ऑफ डिटेल, क्योंकि बहुत ज्यादा अगर एनालिसिस करेंगे तो फिर देन देयर इज अ एनालिसिस पैरालिसिस एंड यू वोंट टेक एबल टू टेक एनी डिसीजन। ओनली योर मैक्सिमम जो है MPHR 220 minus age, this is a very well known and very well accepted formula, and 80% 85% of this MPHR is a target heart rate. For example, I am 50 year age, so 220 minus 50, so uska 85%, so my target heart rate will be approximately 130 like that. तो मुझे 120 130 का मुझे टारगेट करना है डिपेंडिंग अपॉन योर एज। सो उतना हार्ट रेट अचीव करने की कोशिश करना व्हाइल डूइंग योर एक्सरसाइज। पहले नहीं होगा, पहले हार्ट रेट बहुत ज्यादा बढ़ेगा या फिर बहुत कम होगा, बट यू स्टार्ट ग्रेजुअली। और उसमें भी जो हम लोग बताते भी है और हम लोग करते भी थे पहले कि वन पोल हम लोग जब ऑन द स्ट्रीट जब हम लोग जाते हैं तो इन बिटवीन 2 इलेक्ट्रिक पोल, 2 इलेक्ट्रिक पोल के बीच में दौड़ना है, 2 इलेक्ट्रिक पोल के बीच में चलना है, वॉक रन वॉक रन वॉक रन। फिर इंक्रीज योर रन बिटवीन 3 इलेक्ट्रिक पोल्स, 5 electric poles, 7 electric poles, like that on the street. So this is the simplest way of, और फिर टाइम लगा कर सकते हैं कि 1 मिनट दौड़ना है, 1 मिनट चलना है, या 1 मिनट दौड़ना है, 2 मिनट चलना है, like that डिपेंडिंग अपॉन। और एक ऐसा एक फॉर्मूला नहीं है, दिस इज द जस्ट अ लॉजिस्टिक थिंग। हम लोग बता रहे हैं कि कैसे हम लोग कर सकते हैं, कैसे जा सकते हैं टू स्टार्ट विथ, और फिर जब हम लोग उसके आगे चलना चालू होते हैं एंड व्हेन दैट एंडोर्फिन, एनकेफेलिन, ऑल जो गुड हार्मोन्स है, एक्सरसाइज हार्मोन्स रिलीज होना चालू हो जाते हैं, तो देन यू विल फील कि आज मैंने एक्सरसाइज नहीं किया तो आई एम नॉट फीलिंग बेटर, तो वो एक मजा आना चालू हो जाता है। अब रिगार्डिंग ये हो गया, मैंने जो बताया वो एकदम इनिशियल लेवल के जो है टू स्टार्ट विथ, जो लोग कुछ भी नहीं कर पा रहे हैं, जो काउच पे बैठे रहते हैं और कुछ नहीं करने की इच्छा होती है, उनके लिए बताया। एक आधा ग्रुप कोई ज्वाइन कर लो, अगर कोई पीयर ग्रुप रहेगा तो उसमें भी आपको करने की इच्छा होगी। उसके बारे में मैं बहुत एग्जांपल अच्छा देता हूं कि हाउ आई स्टार्टेड विद ऑल दिस एंड्योरेंस थिंग इज वन ऑफ द बिगेस्ट मोटिवेटर इज हियर विद अस, नौकर सर। हम 12-13 साल पहले रोज सुबह हमें उठाना, कुछ लोगों को उनको लेके जाना, पीके में दौड़ाना, तो ये सब काम सर ने किया, और उसी के कारण आज हम लोग, हमारा एक बड़ा सा अकोला का ग्रुप है कि जो ऑल इंड्योरेंस एक्टिविटी, डिफरेंट इंड्योरेंस एक्टिविटीज में भाग लेता है। सो कोई ग्रुप को ज्वाइन करो, कुछ बडीज को ज्वाइन करो। और मैं तो अभी बता रहा हूँ कि द बेस्ट बडी फॉर दिस 35-40 ईयर ऑफ एज, हम लोग सभी 40 प्लस वाले जो लोग हैं उनके लिए, इज योर स्पाउस। अगर हमारा स्पाउस हमारे साथ में ज्वाइन होता है तो इट विल बी एक्सेलेंट। सुबह जो मॉर्निंग, गेटिंग अप इन द मॉर्निंग, गोइंग फॉर द वॉक, गोइंग फॉर द रन, वो सभी चीजों के बारे में आपको एक, इट विल बी अ ग्रेट टाइम फॉर यू, बिकॉज अदरवाइज इफ योर स्पाउस, मोस्ट ऑफ अस हैविंग आवर स्पाउस लाइक डॉक्टर्स, सो बाकी तो दिन भर में टाइम नहीं मिलता, तो कुछ बातें हो जाती है, हमारा एक्सरसाइज भी हो जाता है, एंड यू कैन एंजॉय योर एक्सरसाइज फॉर द पीरियड ऑफ टाइम। सो दिस इज रिगार्डिंग बड़ी सिस्टम। कोई दोस्त है, कोई फ्रेंड्स है, स्पाउस है, तो उनके साथ में बैठ के हम लोग, या कोई ग्रुप हम ज्वाइन करते हैं, तो दैट विल बी मोटिवेटिंग फैक्टर। दिस इज रिगार्डिंग बेसिक लेवल। And regarding moderate or mid level, I'm not talking about expert level, because expert level तक तो हमें जाना भी नहीं है, क्योंकि वो हमारा एम भी नहीं है। हमारा एम है कि हाउ टू इम्प्रूव अवर कार्डियोवैस्कुलर सिस्टम। सो एक बार हम लोग इनिशियल लेवल से आगे जाते हैं तो हम लोग मिड लेवल में, देयर आर 2 टाइप्स ऑफ ट्रेनिंग, हाई इंटेंसिटी एंड लो इंटेंसिटी इंटरवल ट्रेनिंग। अब हाई इंटेंसिटी इंटरवल ट्रेनिंग क्या है कि शॉर्ट ड्यूरेशन में हम हमारा हार्ट रेट बढ़ाने की कोशिश करते हैं। शॉर्ट इंटरवल मस्ट बी 1 मिनट, 2 मिनट, not more than 2 or 3 minutes. 2 minutes is more than enough. For example, you run 100-meter fast, then take a rest, come, let your heart and respiratory rate come down, then again you start 100-meter. So you increase your HIIT to 200 meters, then 300 meter or 400 meter and 800 meters, not more than that. And the funda is, whatever your time you take for your activity, take half of that time for your recovery. For example, अगर मैं 1 मिनट में 800 मीटर 400 मीटर कंप्लीट करता हूं, तो हाफ मिनट रेस्ट करना है. लेट योर हार्ट रेट कम डाउन to a reasonable level, let your respiration come down to reasonable level, and then again you repeat. And repetition, how many repetition? 4 repetition or 6 repetition, that's it. That is high intensity interval training. उसका मैं advantage भी बताऊंगा कि what is the advantage of high intensity interval training. And low intensity cardio training is to just run at the easy run pace. I'm talking about run, but HIIT and all this training can be done in another form also, like in cycling also, like in your weight training also. Rest of our speaker they will talk about that, but I'm talking about the endurance training in especially running and cycling. So low intensity is like easy run, जहाँ पे तुम बहुत देर तक तुम्हारी एक्टिविटी कंटिन्यू कर सकते हो, like half an hour, 45 minutes, 1 hour, 2 hour, 10K running, 21K running at a low pace. That is the low intensity cardio training. तो कौन सा अच्छा है इसमें से? इसमें से दोनों के भी अपने एडवांटेजेस है. बट इफ यू यूज द कॉम्बिनेशन ऑफ स्ट्रेंथ एंड लो इंटेंसिटी, कुछ लोग कहते हैं कि उसका एक वेट रिडक्शन में, स्ट्रेंथ में और तुम्हारा इंड्योरेंस में बहुत फायदा होता है. बट व्हाट आई फील एंड व्हाट आई ऑब्जर्व फॉर मॉडरेट टू और मिड लेवल एथलीट्स इज कॉम्बिनेशन ऑफ ऑल. यू डू HIIT फॉर एटलीस्ट 1 day, once a week, then low intensity cardio training at least 2 days a week and strength 2 days a week. ऐसे 5 दिन strength बहुत important है. Otherwise क्या हो जाएगा? If you do only low intensity cardio training, that is going to increase your endurance, but it is going to eat your muscle. आपका muscle loss होगा और वो muscle loss नहीं होना चाहिए, इसलिए strength training is very important. और उसके बारे में हमारे बाकी के स्पीकर बताएंगे आपको, but strength is important. So रोज के रोज हम लोग दौड़ना चालू करेंगे, तो then you are going to lose lot of your muscles, because वो ग्लाइकोजन, वो सब जो चीजें वो आएगी कहाँ से? ग्लूकोज आएगा कहाँ से? ATP आएगा कहाँ से? So it is going to eat your muscle. So what I feel and what I do is a combination of all 3 activities, like high intensity 1 day, 2 days of strength and 2 days of low intensity cardio. So this is regarding mid-level training. So at the end of this, toward the end of this topic, I like to have 2-4 चीजें भी आज के इस मेरे टॉक में से लिया, तो that is more than enough for you. Exercise is must. उसका और तुम्हारे लिए और कोई एक्सरसाइज नहीं कर सकता है. मेरे फैमिली के लिए मैं नहीं दौड़ सकता हूँ, मेरे लिए मुझे दौड़ना है, और मेरे हार्ट के लिए मेरे को ही काम करना है. एटलीस्ट 30 minutes a day, 5 days a week. मल्टीपल बेनिफिट्स है. तुम्हारा CAC स्कोर कर लो, AC VAD स्कोर पता कर लो, एंड लिस्ट ऑफ इन्वेस्टिगेशन आई लाइक टू ऐड. और दिस इज वेरी इंपॉर्टेंट ऑन योर, हमारे हर एक बर्थडे के दिन हमें इन्वेस्टिगेशन करना है आफ्टर द एज ऑफ 40 years, एंड दैट इज ऑल्सो गिवन बाय मुड़ावकर सर, कि उनके बर्थडे के दिन, अपने बर्थडे के दिन हमें ये सब कुछ करना है, लाइक CBC, यूरिया, क्रिएट, सोडियम, पोटेशियम, ब्लड शुगर, फास्टिंग. ये लिस्ट है. इंसुलिन का भी है, विटामिन B12 एंड D3 लेवल्स, लिपिड्स, LFT, फेरिटिन स्पेशली लेडीज के लिए, TSH एंड हाईली स्पेसिफिक CRP, ECG, 2D echo, TMT एंड सिटी एंजियो. सिटी एंजियो में मैंने बताया CAC स्कोर. सो दिस इज द इन्वेस्टिगेशन, बेसिक मिनिमम इन्वेस्टिगेशन हमारे पास में, हमारा बेसिक बेस लेवल का रहना चाहिए. This is regarding entire thing. I think I have taken more than 20 minutes, so I'm not going to go for my rest of the journey. We'll go ahead during the question and answer session regarding my endurance journey and all. So I think thanks a lot for giving me this opportunity, Tejas sir and IMA Akola. Is that okay, sir? Shall we go ahead with the next topic?
Sir, can I ask you a question?
Yeah, please go ahead.
Sir, for someone who is doing strength training, but he is not an endurance athlete, or who is not very keen on endurance, do you think that he should still do cardiac training, or is the strength training enough to generate amount of cardiac impulse or cardiac stress, which is enough to protect his or her heart?
This is a very important and good question. Because see, anything which increases your heart rate, basically do whatever you like, because in strength also you are going to increase your heart rate. It is, you can do HIIT in strength also. Strength karte bhi tum HIIT kar sakte ho. Even with the dumbbells, with the weights, with the body weight, a number of things you can do here. The basic funda for cardiac training is increase your heart rate, and then it should come down. That is the funda. So it is a very valid question, and if you are not keen on doing a lot of cardio, doesn't matter. Cardio हमारे को पता कैसे लगता है, cardio बोले तो सिर्फ दौड़ना, cardio बोले तो सिर्फ मैराथन करना नहीं. You can increase your heart rate by n number of things, and that is well enough. Even static cycle is okay if you are not liking it, n number of things. But anything which increases your heart is good for your heart. That is what I've seen over the period of time.
Thank you, sir.
So rest of the question I will take at the end, I think, and we'll go ahead with the second talk. So again, once again, thank you, IMA Akola. So I'll introduce the next speaker. Our next speaker is Tejas Waghela. He has done his MBBS and MS ortho from prestigious GMC Mumbai, and his MRCS from Edinburgh. He is trained in orthoscopy and sports medicine at ISAKOS, ISAKOS, and he worked at Konkuk University in Seoul, which is recognized by Korean Olympic Association. He is presently Secretary IMA Akola, and is a president-elect of Rotary Club Akola, Midtown. And he's one of the important thing of Tejas is he's treating elite athletes, including national level boxers, sprinters, and cricketers. He has got a special interest in sports and sports medicine and sports and dance injuries. He is very passionate about his sports and fitness. He's a very avid cricketer, and his specialty is in functional training. So I'll request Tejas to go ahead with his talk. Over to you, Tejas.
Thank you, Parag sir, for this nice introduction. And thank you once again for a very enlightening talk. After your very, I would say a very tough talk which you handled, I would like to start with my very basic talk. Just give me a minute, sir. So is my full screen visible?
Yes. Go ahead.
Thank you, sir. So I once again welcome each and every one of you. My topic, which is designated, is in the how-to series, is how can we keep our joints safe? So I believe that mobility is the key to longevity of a joint. And what is mobility? Mobility is the ability of a joint to move freely through a full range of movement without pain or discomfort. Now you can look at these two pictures. I'm sure one of the pictures on the right, you all must have seen on your OTT platforms or on your in the theaters in the recently concluded very hit movies. But the one on the left is very important, wherein an Ajoba is sitting, and he's sitting so freely. And I think that squat is the most underrated exercise in the world, which has been, which started in our culture. And you can see such an old man with a full ankle dorsiflexion, full knee flexion, hip flexion, with spine which is straight, and his head is centered with an absolutely good posture. This is possible only because he's been mobile, and he's been training mobility by doing squats, by sitting like this each and every day. When people ask me, I want to be flexible. Some athletes come, they say, I want to be more flexible. Some say, I want to increase my performance. I say that you should be more mobile. So what is the difference between mobility and flexibility? Well, mobility is an active range of movement, while flexibility is passive. As you can see, if you keep a TheraBand on your foot and try to pull it, you're passively stretching the hamstrings. But if you do the same thing with a straight leg raise, you're actively contracting your hamstring to stay in that position. And that's what mobility is all about. What are the major benefits of mobility? you have freedom of movement, injury prevention, performance. What do I mean by freedom of movement? Well, freedom of movement is something that each and every one of us want. We want to play with our kids. We want to play hide and seek. We want to climb trees with them. We want to become child like them. We want to dance in parties. We want to celebrate our victorious moments. We want to have more energy. What is injury prevention? Well, injury prevention is specific to athletes, but in our day and age, again, we have seen that patients with restricted hip mobility have strong correlated pathologies of hip, spine, and lower extremities, as well as stiffness in ankles increases risk of knee injury. There's a very interesting concept which we look in our practice, which is called an internal rotation deficit, which is predominantly present with overhead athletes, because as they externally rotate their hand when they are doing all their overhead activities, their anterior structures are stretched, but the posterior structures are contracted. So when they do an internal rotation, the internal rotation is not possible because of a stiff posterior part. And all these lead to overuse injuries, including rotator cuff tears, posterior labral tears. What do I mean by performance? Well, mobility is the backbone, or rather the base of this pyramid. If you are mobile, then you can be stable. If you are stable, then you'll be able to gain strength. Once you have adequate strength, then you can have power. And with power, you can develop any kind of skill. May it be in dance, maybe it in sport, maybe it in your day-to-day activity. So mobility is the basic. जैसे मेरे कॉलेज में पहले बोलते थे कि बेसिक में राड़ा नहीं चाहिए. So अगर हमारे बेसिक में ही राड़ा है, BMR है, अगर मोबिलिटी में ही राड़ा है, तो हम स्टेबिलिटी, स्ट्रेंथ, पावर नहीं गेन कर पाएंगे. There is a very interesting concept which I have found out as well as which I practice, which is called the joint by joint approach to mobility. All of us are sitting on desks in our OPDs. As surgeons, we are sitting on the table while operating for multiple times. What we tend to do is our neck goes forward. This puts undue pressure on the neck, as well as the flexors get contracted. So you have stress on the shoulders. The thoracic spine droops, that increases the pressure on the thoracic spine. Because we are sitting, the hip flexors become tight and the ankle dorsiflexion decreases. So let's look at all these four joints, because once again, let me get back to these four, and these are the joint by joint approach. I'll give you a small self-assessment tool, which each and every one of you all can use at your own houses and get better in your mobility. When you look at the shoulder assessment, this is a very classical textbook picture from orthopedics and sports medicine, which is called the Appellate scratch test. The first thing that you want to do is take your shoulder in abduction and externally rotate. If you're able to touch the opposite side of scapula, that means you have adequate forward flexion and external rotation. Do the same thing by taking your hand down at the back. And if you're able to do this, that means you have adequate internal rotation. If you're able to touch both of these together, that itself proves that you have good shoulder mobility. So you assess this, you look at what are the lacunae that you have. If you have decreased flexion, abduction and external rotation, or do you have a decreased internal rotation? There is a very simple way to increase this. You can use a simple towel, you can use a rod, and basically if you have restricted abduction, you can pull this up because this is active against resistance. You're doing a resistive exercise, and this is giving you mobility in abduction and external rotation. And if you do the same thing with the hand down, you're trying to increase your internal rotation. What about thoracic spine? Look at this young girl trying to take a selfie. I would encourage each and every one of you all to take your own pictures. Now, taking your own pictures is not just for showing off or stuff. It is to self-assess, to look at your posture. So the best way is to take a mirror selfie and see what kind of position you are in, whether your neck is going forward, whether your thorax is drooped, whether your back is hunched. If all these are present, that means that you can definitely work on your thoracic spine. And the two very important exercises that I recommend are thoracic extension, which you can see the lady doing on the left. So you can use a bench, Keep your elbows on that bench. Keep your hand clasped, your knees flexed, the knees at line with the hip, and you extend passively, stretching the lats and actively getting your thoracic spine mobilized. So this is the first plane of movement. The second that you can do is what we have a very simple Yogasana, which is the cat-cow posture. I think this is one of the most underrated, but yet the most effective in thoracic mobility. As you can see, the person doing it on the right, when you are doing the cat-cow position, you should see to it that your belly button is sucked in when you flex the thoracic spine. And when you extend the spine, the scapula moves backwards and retracts itself to the fullest. Again, in this case, the wrist, elbow, and shoulder are in the same line. The knees and hips are in the same line, while the ankle, the foot is relaxed in neutral position. Thoracic spine is very interesting because not only does it take care of the flexion extension, but it is also very important in trunk rotation. And that's why this is the mobility routine which I follow, which is basically doing external rotations by tucking the elbow onto the opposite wrist. So what this does is moves the thoracic spine in the rotational plane. Coming to the hip ankle self-assessment, I think, again, I would get back to those two pictures. The picture on the left, where the actress is sitting in a hip abducted position. This is also very important because a lot of us, a lot of our patients that we see, as well as in fact us, if we'll reassess, we'll look at that we don't have a lot of adequate hip mobility. So you have to abduct your hip when you're doing a squat. First of all, see whether you will be able to sit in a squatted position. If you cannot sit in a squatted position, I would recommend you decrease the dorsiflexion of your ankle. This can be done by using yoga blocks so that the ankle is a little less dorsiflexed and still you are able to come down. And if you're not still able to do it, the other way to level it at a lower level is to use the quad, sit on the chair and actively do that squat and see if it's possible for you to do it comfortably. The best hip mobility routine, this is the one which I follow. This is actually done by jiu-jitsu Brazilian martial arts workers, players. And we call it the 90-90 stretch, which as you can very easily see on this diagram picture, whether one leg is flexed in a 90 position and the other is flexed with external rotation. Then you bend forwards, as you can see is in figure 2. Then rotate your trunk, which takes care of the lumbar spine flexibility. Turn your legs, again abduct it and switch it to the different 90-90 position. This 90-90 position takes care of your hip mobility. What about the ankle? I feel ankle is the most underrated joint in terms of performance. A lot of people who cannot squat, they cannot squat is not because of their leg strength. Rather, it is because they lack ankle mobility. And the best way to increase your ankle mobility, what I recommend is doing a goblet squat or a shuffling squat. So what you can do, as you can see on the extreme left, this person has a weight. You can use any body weight. I personally use a kettlebell. You can go down up to deep flexion, transfer that weight onto the ipsilateral ankle and the leg. So take the weight, you're going on the left side as you're squatting, you will feel the whole weight from the axis, from the spine up to the left hip, the left knee and the left ankle. You do the same thing on the right side. This will gradually stretch the hip muscles. This will gradually stretch the hamstrings, actively stretch the hamstrings and quadriceps and increase dorsiflexion. The second important way to do it is by doing a wall push. Again, the technique which you have to use is see to it that you're in the same line and the limb is not in extreme external rotation or internal rotation. And the last thing that you can do is use an elevated plank, and on that you can put the foot and push it gradually. I personally don't do a lot of isometrics or stretches for a long time because again, it depends on what kind of performance you want and what kind of targets that you have set for yourself. So after this small assessment and the routine, you will ask me that how frequent should I train? The person on the left has more hair than me, but I think both of us carry the same answer, which is we don't know. Actually, we don't know how much we train because it all depends. It depends on what you want to do, whether you want to be an endurance athlete, whether you want to be an explosive athlete, whether you want to just be with your daughter and play with her, whether you want to climb a tree, whether your target is to reach Mount Everest, or might it be just that you want to practice your profession in a very functional way. So all targets depend on what you want to do. However, from these 3-4 things that I have talked about, you'll be able to assess for yourself where you lack. Say you lack in ankle mobility, work on it daily. Say you lack on your hip mobility, work on it daily for 10 minutes a day. There's a very interesting book which I have been reading, which is called Atomic Habits. And I thought this is something wonderful that each and everyone should understand. Whenever we are working on any skill, now in this thing, I would say that your skill is that you want to increase your hip and ankle mobility. What you will see is gradually as you work, what you expect is a gradual increase in performance. But this doesn't happen. Actually, there is a large valley of disappointment. But this valley of disappointment is what you need to overcome. If you cannot overcome it, you will always be in this valley. मला जर असं वाटतंय की मी रोज करतोय आणि एका महिन्यामध्ये मी पराग टापरे सरांसारखं आयर्नमॅन बनून जाईल तर ते होणार नाही. मी रोज करतोय मला वाटेल की मी डाबरे सरांसारखं 100 kg स्क्वॉट करेल ते होणार नाही. I have to do it slowly, and then I'll be able to become a Prashant Moravkar or a Tejas Waghela, or for that matter, any other person to reach my goal. So what actually happens is you have to take yourself up that valley of disappointment. The other thing which I thought from the book, which was very interesting, is you should not be focused on your goals. You should be focused on your systems. Like when initially I started my fitness journey around 7 years back, and in fact, Dr. Ashutosh, who is a very dear friend of mine, can tell you that initially I had a goal. I had a goal that I want to become this, I want to become that. But I think gradually over the last 7 years, and as I have become more older, I dare to say that I've become more wiser, and I have started to follow a system. I don't want to become an endurance athlete. I don't want to become the best cricketer that I can, that is there on the planet. I don't want to become the best dancer on the planet. I don't want to become the best doctor, but I want to follow a system. I want to follow this system and see where this system leads me to. Maybe the system will lead me to greatness. I don't know, but I want to follow that system. So you jot down your own lacunae in terms of your mobility. You jot down what you want to do and follow that system diligently. Avoid that valley of disappointments. Stay consistent in your actions. And if you follow that, rest be assured that you're at least going to improve from what you are, and be satisfied with it. And God knows you might also become great in the process. There's another very interesting concept which I wanted to shed light on when you're looking at mobility, which is non-exercise activity thermogenesis. So when we are discussing exercise today, we are discussing fitness, we are looking at 1 hour out of 24 hours. Now, if you sleep for 8 hours, you have a further 16 hours, 1 hour exercise. So 15 hours you have when you can do a lot of things, which could be very small, like maybe take your spouse, for a walk, talk with her for the whole day, what you've done. You'll burn calories in it. You'll de-stress yourself. Take the stairs. Avoid taking a lift. Play with your kids. I think kids teach you more than anyone else. Kids are very free. Their movement is so unhindered. You can learn from them. आपण जेव्हा लहान होतो आपण गोलांट्या मारायचो. आता तुम्ही ट्राय करा, होणार नाही. You have to learn that. You have to again learn that skill. That skill is something which we have forgotten. Clean your house. That will decrease the clutter around. That will create more positivity in you and also burn a little bit of calories. Go shopping is something your wives as well as the female attendees would be very interested in. But I think that is also a very good way of decluttering your mind, as well as doing some activity which will increase the thermogenesis, burn some calories, burn some fat. So to conclude this small talk, I would say that mobility training is actively moving joints through range of movements functionally. It prevents injury and increases performance. You self-assess, look at your shoulder, spine, hip, and ankle mobility. Your training depends on your area of work and need. Whatever you want to achieve, you set a system for it. Be consistent and avoid being stuck in that valley of disappointment. And be active throughout the day. Remember, NEAT. Thank you so much.
Excellent talk, Tejas. Nicely explain your mobility, and we'll definitely have a lot of insight because of your this talk. I think we'll take a few questions at the end. Is that okay?
Sure, sir. Sure, sir.
Yeah. So I think we'll go ahead with our next talk. You please introduce our next guest speaker.
Sure, sir. Sure, sir. So it is my pleasure to introduce Ashu, my dear friend, Dr. Ashutosh Dabre, whom I know since a very long time, as we both are from the same batch and from the same college. Dr. Dabre is an eminent orthopedic surgeon from Akola, and I would call him a doctorpreneur. He's a doctor who is an entrepreneur, who has multiple businesses which are running very smoothly. He has one of the most hep and most happening gym in town, TWC. And even though he's an owner of the gym, he has himself educated himself to be a coach. He's a hammer strength coach as well as a K11 strength coach. And I think he would give us great insight into the strength part of how to have strength, gain strength, and maintain strength. So over to Dr. Dabre.
Thank you, Tejas. Thanks a lot for that nice introduction. Saturday evening, and we are having 300 plus participants for this talk. That means more and more people are interested in getting fit and having strength. So good evening all. I hope my screen is visible.
Yes, Ashutosh.
Yes.
So how to
Ashu,
gain
full screen करावी लागेल. Full screen करावी लागेल. Slideshow full screen.
Yeah, it's full screen from my side. Just a second. Now, is it full screen?
Not yet, Ashu.
Now, is it full screen, Tejas?
Ashu,
Yes, sir.
just move your mouse.
Okay.
No, we are not able to see your mouse movements.
Just
Unshare the screen and share again.
Yeah.
Yeah, now share again.
Now, is it visible, sir?
No, you are not yet shared the screen. Yeah, now you have shared the screen, open PowerPoint. Go to
Okay.
slide.
Yeah.
Now it's full. Yeah. Thank you.
Okay. Thanks a lot. Good evening, everyone. 300 plus participants in Saturday evening watching this fitness webinar. That itself says how people are concerned about fitness nowadays. So give me 30 minutes for this talk, and I will definitely assure you next 30 years of your life will change. That's my promise. So nice introduction given by Tejas. So let me introduce myself once again. By profession, I am orthopedic surgeon. By passion, I am a gymmer and gym owner. So myself, Dr. Ashutosh Dabre, welcome you all for this webinar. My topic is how to maintain strength, how to gain strength. So we are working with Hammer Strength Clinic, K11, TRX, and all these brands. We have our own team who have designed their protocols for exercises and gaining strength. So let me once again share this definition, which Tejas has already said: the ability to carry out day-to-day tasks with vigor and alertness without undue fatigue and with ample of energy to enjoy leisure time pursuit and to meet unforeseen emergencies. Let me give you a practical example. This definition never mentioned six-pack abs or marathon or something very fancy. It is definition which is most accepted for fitness, ability to carry out day-to-day tasks. Yes, and don't forget the last line, unforeseen emergencies. What are the unforeseen emergencies? We are medical profession. Come on, we are not going to fight on boundaries and all. Unforeseen emergencies means you are at a railway station waiting for your train and suddenly an announcement comes, platform number 4 से आने वाली गाड़ी platform number 6 से जाएगी. So you have to carry your luggages, go to platform number 4, go to platform number 6 with your luggages. If you are elite athletes or for say you are runner, you can run and catch the train. If you are weightlifter, you can just carry your baggages and try to catch the train. But you have strength of both running and lifting up the bag. You will be definitely able to carry out that task, which is unforeseen emergencies for us. So let's see how can we achieve that strength. There are 5 components in fitness: muscle endurance, muscular strength, cardiac endurance, flexibility, body composition. This is very important. Sir has rightly said, you have to have all these mobility functions, cardiac endurance with you. Only doing cardio activity will not give you muscular endurance or muscular strength or body composition. So how to achieve all these 5 components in strengthening? It depends upon frequency, intensity, time, how long you work out, and type of exercises you do. People have different mindset, different sets. They say my workout is the best, but it is not the thing. We are here to discuss what is the perfect way of doing it. So let's start. So this is myth: cardio for weight loss and lifting weight for bodybuilding or muscle building, right? Many of us have this thought. If you are obese, go to ground, have your cardio, you will lose weight. If you want to become a muscular bodybuilder, go to gym, build muscle, right? This is, we have been seen from ages: cardio for weight loss and lifting weight for bodybuilding. So is it true? Let's forget about science for a minute. In our day-to-day language, what we talk about? We talk about 56 inch, 56 inch ka सीना. We talk about 2.5 kilo का हाथ. We never talk about average कितना देते हो भाई. Average तो गाड़ी देती है. So these are our day-to-day talk. We talk about strength unknowingly, and we don't talk about the cardiorespiratory endurance. Nowadays, we can see the actresses lifting heavy weights. You all know the actresses are doing the extreme fitness activity. Like in this picture, you can see the Samantha is doing 100 kg deadlift. So why people are with the strength training now? Why they have shifted their focus? We can see elite cricketer players lifting weights. Rather than playing only cricket, they prefer to go to gym and lift heavy weight. So how to gain strength and lose fat and not weight? See, weight loss we always talk about. Weight loss, we always say that I am obese, my BMI is say 25 and I want to lose weight. Losing weight is a bad idea you can ever think of. We talk about fat loss, not weight loss. Fat loss is something which is advisable nowadays, and weight loss is the worst thing you can have in your life. See, 60 kg lady having same kilogram may look different to your eyes. So fat loss people are those who are obsessed with calories and all. They go to wedding, they first calculate the calories, how much this dish is having calories, and they try to eat or avoid that dish. They do tons of cardio. These people will be seeing around, walking around the streets and doing cardio only. Follow fat diets. May it be a keto diet or GM diet plan. All this diet don't help you in losing fat. So what we should focus on? We should focus on losing fat rather than losing weight. Resistance training is the way of doing it. High protein diet will definitely help you build good muscles, build a lean muscle, and look toned and strong. So as I have already mentioned, weight loss is the worst thing you can have in your life, because weight loss, you will lose muscle, you will lose water, and yes, you will lose fat also. But with fat loss, you will be focusing more on losing only fat. In excessive cardio exercises will lose muscle, water, and fat. As I already mentioned, all this fancy diet, people try to do it, give up after some days, again become fat. So come to the journey of fat loss. You will be eating whatever you want. Yes, whatever you want. 90 to 95% of the food you can have whatever you want. Does 30 to 45 minutes exercises will definitely definitely age or fat loss. What fat loss and weight loss difference have in all over body composition? See, skinny people will have decreased energy. They do diet and all. They restrict themselves from eating food, and they do only cardio. They will have decreased energy, decreased strength, decreased stamina. They will look older than what they are and reduce immunity. On the other hand, if you focus on fat loss, you will have an improved fitness, increased strength, reduced risk of disease, and delayed aging. So that is the advantage of fat loss over weight loss. In our TWC, we always talk about fat loss and we never focus on weight loss. So this is very logical. Same kg of fat will occupy more space than same kg of muscles. So toned body is always good than fatty chubby body. So this is now science. Weight versus cardio. Same exercise which you are doing, elliptical, treadmill, and weight training for an hour will have more calories burned than other any cardio exercises. Why? Because weight training have the advantage of afterburn effect. So now what is afterburn effect or epoch effect? Afterburn effect is the something which you see after exercises. It is hype that it may last up to 48 hours, but you can definitely say it may last for 6 hours to 12 hours. Afterburn effect is something which you experience like soreness of muscle and all, means you have come from the gym, still you are feeling that something is going on. That something is nothing but burning of calories. Afterburn effect is advantage which is not seen in any other form of exercises. It burns more calories than aerobic exercises for the same amount of time. But there are two schools of thought. Some may agree upon epoch effect and some may disagree on it. but the elevation in the metabolic rate is due to the repair process the body undergoes after a lifting session, and it's different from the epoch. Extra calories your body burns after exercises to return to normal homeostasis. Means if you work for 45 minutes in a gym, you do a good deadlift. After that, there will be micro trauma to your muscles, say back muscles. What happens after that? The body tries to come to a normal state. How it does that? It does a micro repair by doing many break and break procedures in the muscles, which is the advantage only seen in the strength training exercises. What happens in cardio? Cardio also you will get after effect, but it will be restricted to only lower limbs and not the upper limbs. So this is the advantage of doing strength training over the only cardio exercises. Time is also important thing. We all are busy practitioners. We need to have a good amount of exercises in lesser time. So with strength training, burn more calories, say less than 45 minutes in a gym, 4 to 5 days a week. So you can burn more calories with strength training with respect to only cardio training. So this is the chart which is showing how much calorie you burn after doing various type of exercises. So here you can see squats, 150 kilocalorie is the max you can burn with doing strength training. So it's up to you. You can lose fat by doing anything, but how you want to look like this lady who is also having a 6 packs, but see her body composition. She will look skinny and will be looking older than her age. And lady to the right is doing weight training, and she is also having the same kg and toned body. Body composition is definitely better in doing strength training. This is marathon runner versus sprinter. Of course, there are many variations. This is the extreme ends you can compare. But yes, you can look around your friends and all. Those who are just walking around, those who are just running, they will look like this skinny person. And those who are doing strength training in a proper way will have more toned body. So what is the mantra? Just focus on losing fat and keep muscle intact. You have to have calorie deficit, lift heavy weights, and have a high protein diet. By calorie deficit, I doesn't mean you have to strive for food, you have to cut down your food, you have to have a lower intake. No, calorie deficit is something which is out of scope of this talk, but I can just say that calorie deficit is replacing high calorie diet with good amount of protein diet. Calorie deficit can be done by reducing intake or exceeding the outflow. So intake, if you want to, someone is foodie, want to have anything he likes, he can have, but at the same time, if he lifts heavy, do workout, he still managed to be a calorie deficit. So I knew you will ask for evidences. As this is talk for IMA, I cannot just show slide and prove my point. So here is the evidence. This is the paper presentation done in 2012. This is there are n number of papers for and against the strength training. You can Google it, but there are many papers who definitely are for strength training. This is study done, and why I have included this paper, because it has highest number of participants involved, and what they do, they have formed a 3 groups. First group is for a cardio exercise only, second was strength training only, and third group was strength plus cardio training. And they have monitored over 8 months. They have given a fixed period of time to every participant, and they have measured all calorie intakes and all. So what was the result? Result was weight loss in various exercises, and this is shown in this. This is resistance, that is strength training exercises. The group which was doing resistance training have gained weight. The aerobic training means cardio, those who are just running around, have lost weight. And third group, which is combination of strength plus aerobic, have lost weight also. Here you can see the aerobic training group has lost maximum amount of weight. See, I am talking about weight loss. I am not talking about fat loss. This is the weight which the group has lost. Now, as I have already told you, we actually want to have a fat loss rather than having weight loss. So this is the actual scale. This group, which is resistance training group, has gained muscle endurance also. And this is muscle part. So ultimately, they are having less fat loss, and rather they gained weight because of these muscles. Only aerobic training group has lost this muscle, and they have lost fat also. Resistance plus aerobic training group has gained some muscle, and fat loss is maximum. So disadvantage of doing only cardio is this one. This is the muscles which we want to have it, not to lose it. So $1,000,000 question is how to do it. Yes, we now will come, we will now to agree that weight loss is something bad and fat loss is something good. But how to do fat loss and how to gain weight, it is the important thing. As I have already told regarding fitness and all, every people have his say. He will say my exercise is best, this way of doing is best, this is the best. But we should come down to some scientific data also. So this is the tripod of fitness which we are following since 5-6 years. This say you can have muscle atrophy, which will lead to ultimately fat loss by doing progressive overload, rest and recovery, and nutrition part. If you follow this simple tripod in your fitness activity, you will definitely reach your goal, whatever goal it may be. Maybe fat loss, maybe athletic body, maybe body proportion. You will find your answer in this tripod of fitness only. Progressive overload, rest and recovery, and nutrition part. As I already said, nutrition is out of scope of this talk. We'll be talking about nutrition in next part. But yes, we can talk about progressive overload, rest and recovery now. So this is Milo. What is progressive overload? Milo was ancient Greek athlete. What he used to do, he daily used to lift a little more than he can carry. So ultimately Milo grows, as well as the weight carrying capacity of Milo also grows. So this is something we recommend in the gym, progressive overload. So progressive overload will definitely build your muscles and decrease the fat. Different group of muscles in a week. Yes, rest is something we all admire, we all like to have rest. See, sir has already told you, 2 days cardio, 2 days rest, and 2 days strength training will be a good calendar data you can. So this rest is what? Rest is nothing like giving rest to particular group of muscles. Like what you can do, if you are doing biceps today, you can have rest for bicep for next 3 days. Till that time you can do shoulder or back or abdominal muscles. Rest necessarily does not mean that you should avoid going gym or having any other activities. So rest is planning your schedule according to the group of muscles, which will give definitely advantage rather than going each muscles every day. So rest is very important in this triad. So what I recommend is eating right, not less, and burning more. So these all you think you can find out on internet, like detox diet and all, 10 minutes ab workout, fancy items, fat diets and crash diets, these body wraps, endless cardio, and of course, now supplement market has also come in the business. But according to science, be calorie deficit, eat less than you burn. Calorie deficit you can very well calculate. There are many apps. It's not a big deal. Strength training definitely have advantage over other trainings. So go for strength training. Do some cardio. I am not against cardio. Myself has run more than more than dozen of marathons and still doing cardio also. I am not against cardio, but yes, you have to balance your workout. Focus on quality sleep. 6 to 9 hours they say sleep is very adequate. Consistency is have more advantage than perfection. Tejas has also mentioned, if you are consistent and bit imperfect, still you will manage to have a good shape. Patience is the key. You will have to wait to have a good body. Many of you will think, if especially female candidates, if I go to gym and I lift a weight, I will look like this lady. But no, if you go to gym, you lift weight, you will definitely look like her and not like her. Because strength training again has a definitive advantage of having afterburn effect and fat loss. So how to maintain? How to maintain? Suppose you have done good exercises, you have gained weight. How to maintain that? Avoid crash diet, avoid just cardio exercises, avoid low protein diet, and avoid sedentary lifestyles. Have a balanced diet, have a healthy lifestyle, have healthy protein in your day-to-day food, and exercise daily. That is the key to success. Now, before I end, there are some take-home messages. As I already said, don't do only cardio, lift weight. Don't glorify weight loss. Talk about fat loss. Come on. We are seeing many people talking about weight loss. I have done this crash diet, I have done that, and I have lost so many weight. Weight loss is not the healthy way of doing it. Talk about fat loss. Have a balance in eating and workout. You have to have balanced workout. It should contain lifting weight, running around, and playing sports. Strength training touches all 5 components of the healthy lifestyle of maintaining strength and having fitness. As Tejas has asked sir about the strength training and cardiorespiratory status, it is mentioned, and it is mentioned in the books also, the strength training also touches the cardiorespiratory part of it. Like there are CrossFit and HIIT workout, which have high endurance sports for cardiorespiratory. Strength training saves time and have more sustainable effect. Yes, strength training saves time. 45 minutes of workout in a gym rather than going for 4 hours of cycling, 3 hours of walking, and doing all these things. Strength training have definitely edge over that. It saves time and it saves money also. You will agree, after Corona, there has new cyclist group has come around in every city. They are buying fancy bikes. They are riding around. A cost of one cycle is around 1,05,000, 1,20,000. In that, you can have a membership of gym for say 10 years also. So in that way also, it is beneficial to go for strength training. Good body composition is a brand. Yes, good body composition is a brand. You have not to mention that I am a bodybuilder or I have a good physique. It is shown, it is seen, it is appreciated by everyone who is watching you. You don't have to carry your bib number or running number with you. Good body composition is must and everyone should have it. So this is today's headline in दिव्य मराठी. सायंकाळी 6 वाजेनंतर खाऊन जिम मध्ये न जाताही आवडीची ऍक्टिव्हिटी करा. बदल करण्यासाठी स्वतःला आरशामध्ये बघा. So these are some funny headlines we can have in WhatsApp and all groups. This is the article which was mentioned in दिव्य मराठी. मी हे आर्टिकल वाचलं. याच्यामध्ये कुठेही दिलेलं नाहीये की don't do weight training and all. This is all marketing gimmicks. People like to avoid gyms. People like to avoid workouts. People like to have something they want with minimal efforts. This is my Bob, my dear friend. Now he is inspired by newspaper, and look how Bob has turned around. So don't go for shortcuts. Life doesn't run on shortcuts. You have to have definitive plan. You have to have definitive goal. You have to walk on the path. You have to have a strength training. You have to have balance training. You have to have definitive workout plan to achieve your goals. B through TWC has transformed many lives and still doing it in scientific way. If I talk about myself, it will be my personal bias. So we have touched more than thousands of lives. We are changing their lives. Strength training and workout proper way has definitely changed the life of many and will continue to change life of many people. Thank you for your patience listening. Thanks a lot, Tejas and IMA team, for giving chance to speak for this lovely crowd. Thanks a lot.
Thank you, Ashutosh. Excellent talk. And everything and anything in moderation is good. And that is the basic message we want to give all of us from our team IMA Akola. I think, Tejas, can we go ahead with our next talk?
Sir, there were a few questions. One question was for you, Parag sir.
Yes,
they wanted to ask that there are so many elite athletes, who have heart attacks. They're sports person or celebrity who exercise daily. So what do you think are the reasons for these people having these heart attacks?
Yeah, there are a number of things are going to that. And I was knowing that this question is going to come because there are like a few newspaper headlines that showing that the such and such person, such and such ortho, such and such anesthetist who was doing his workout and he collapsed, and then that video is getting viral. See, there are a number of reasons for that. And it was very important. This is one very important topic. Like one of the reasons why I'm talking about this is regarding Corona and post-Corona recovery, how to go about it. And when in this third wave, I got a Corona, and it was like not this one new strain, but it was an older strain, Delta. You got it because you are in such a good go about the recovery. And why these athletes, those who are in the recovery, are getting a lot of like cases of sudden cardiac arrest. So there are three parts. One thing is why I got it. So there are a number of reasons, and I don't need not to go into the details of why I got the Corona. You can get in spite of your exercise, in spite of your all vaccination and all. Second important thing is recovery that I am going to touch now, because a lot of us has got positive with symptoms, without symptoms, but we have got a mild symptom, moderate symptom. So the thing is, if you don't require a hospitalization, and there is study also, and there is one paper also, and there is a nice study about this thing. In that case, at least you will take 3 to 6 weeks, mild to moderate symptom, not requiring admission. 3 to 6 weeks for coming your heart to the original level. जो तुमने पहले कोरोना के पहले तुम्हारा जो एक्टिविटी था, हार्ट लेवल था, हार्ट रेट का लेवल था, वो आने के लिए 3 to 6 weeks required. If it is a moderate to severe in requiring admission and oxygenation, it will take at least 6 months to come down to your original level. अब एक्सरसाइज कब चालू करना चाहिए, ये सेकंड क्वेश्चन रहता है एथलीट्स के लिए, हमारे लिए सबके लिए, कि अब यार मेरे को कोरोना हो गया, उसके बाद में मैं रिकवर हो गया. Two things are happening with corona, like you have a lot of myalgias, you have sleep disturbances. These are the two important things which I came to know, and I have also experienced that. I used to get up in the morning at 5 o'clock, then it was like a lot of myalgia, not able to wake up in the morning, sleep disturbances. But believe me, over the period of time, just wait for it. हमारा जो एक्सरसाइज रूटीन चालू करना है 3 वीक्स, माइल्ड टू मॉडरेट जो सिम्टम्स थे उसके लिए 3 वीक्स के बाद में ही चालू करो. डोंट रश. और इंक्रीज कैसा करना है? यू इंक्रीज बाय 2 or 3 days. 3 दिन के बाद में तुम थोड़ा इंक्रीज करो. सो टोटल टाइम इट विल टेक 6 weeks. 3 weeks के बाद में चालू करो और 6 week तक तुम्हारा ओरिजिनल एक्टिविटी तक आओ, 1.5 महीने के लिए. If you got a severe symptoms, then please wait for at least 2 months to start your activities. Don't do your activity, vigorous activity, but start doing your some yogasana, pranayam. That is important, and that helps a lot in your sleep as well as your flexibility. And then you be slow again when you are doing your exercise after your severe corona. Like after that, you take at least a 5 days to 7 days to increment your exercise and space it out over the period of 6 months. देखो कैसा है, हमें हमारा we don't want to increase our life or increase the days in a life. We have to put a life into your days. So that is one thing. And the question is asked is specifically about why these deaths in athletes. You know, there are a lot of things going to that. Post-corona recovery, that is one of the important strong factor. Don't rush it. Second thing, genes. Genetically, हमको पता ही नहीं यार कि हम हमारा क्या हो रहा है, लेकिन because we are genetically more prone as a race, Indians, for our coronary artery or sudden cardiac deaths. अब जैसा हाईलाइट होता है कि वो मैराथन करते करते एक बंदा गिर गया, मर गया. अरे भैया उसका परसेंटेज देखो, 1 in some million. एंड लास्ट थिंग जो आपने डेफिनेशन ऑफ फिजिकल एक्टिविटी दिया है कि वो इमरजेंसी में हमको काम करने की इच्छा यानी इमीडिएटली करने का उतना ये रहना चाहिए, स्ट्रेंथ रहना चाहिए, डे टू डे एक्टिविटी करते आना चाहिए. सो दिस इज व्हाट आई थिंक regarding the sudden cardiac death. There's a huge articles and there's a lot of discussion going on everywhere. I'm not an expert in that, but what I found out and what I think is this.
Prashant sir, you raised your hand. You had a comment on this.
No, actually, I raised my hand and also lowered it because that was covered by Parag that you cannot change the genes. Right. You cannot change the genes. And everybody is going to die. The day he is going to die is written somewhere. Only thing is you do not know. But that does not mean that I should not be exercising. That does not mean that I should be eating anything. That does not mean that I should not have a healthy lifestyle. You have to be healthy. That's the only thing. There can be any reasons. आज तो पाप करने वाले भी जो राज कर रहे हैं, लेकिन इसका मतलब पुण्य करना बंद करना चाहिए क्या?
Agree. Perfect.
Right, sir. Sir, can I be a devil's advocate? Ashutosh just said that, he showed us 2 photographs of an endurance athlete who was looking like a 90-year-old man and another who was looking young, where he's propagating that you go into the gym and you look younger. So Prashant sir and Dabre sir, who have been an avid endurance sport, and both of you all still look very young. So let's have a bit of a small discussional debate on whether endurance is better or strength training is better.
No, Tejas.
Yes, sir.
We also do strength training.
Yes, sir.
We also do strength training. We do not run every day.
Yes, sir.
That's the thing.
Yeah.
Only thing is, it doesn't mean that I do not go to gym. I do my gym at home.
Yes, sir.
Yeah.
Yes, sir. I mean, that's the take-home message for anyone who is watching and who is going through our discussion. That everything in moderation, and you have to have a very good combo of cardiac as well as strength training. And strength training can also be done at home. There are a lot of body weight exercises that you can do. In fact, weight training is not only using a dumbbell or a barbell. Your own body weight itself is today a 70 kg weight. And अगर आप खुद को उठा पाते हो, तो आप माइलो भी बन सकते हो, जैसे डाबरे सर ने बताया.
Yes, can I add to this?
Yes, sure, Ashu.
Why I focused on strengthening and not just cardio? Because some people feel that walking 3 kilometers is enough. Means we have seen many people walking around PKV for ages together and they have not lost 10 gram also. What people do, they think that walking 3 kilometers or 5 kilometers is a exercise which they are doing for ages and still not getting any benefit out of it. So this is not the thing. My point was not against the cardio. My point is we should have a combination of everything and everything works for you. But definitely many patients come to us and they say, Dr. Sahib, आम्ही तर 5 किलोमीटर चालतो, मग तरी वजन कमी होत नाही. मला गुडघा दुखी आहे तरी मी 5 किलोमीटर चालतो. This is mentioned in literature that after aerobic exercises, the actual calorie burn will start after 40 to 45 minutes. So if you are doing 15 minutes walk or 20 minutes walk, it is not going to help. Some people, as seen, athletes also, means they are running around and they are just doing cardio and no strengthening. So it will have a disproportionate body. So to avoid that, you always go for strengthening as well as cardio. You should have balance between. That's my point.
I went through, Dr. Ashu, I went through a very interesting meta-analysis where they said that if you do 30 minutes, bang on 30 minutes of walk daily, what it helps is it increases your metabolism. The biggest problem with people who want to lose weight is they have metabolism unka gadbad rehta hai.
Right.
To increase the metabolism, 30 minutes of steady cardio, gentle cardio, which is not very overwhelming on the heart, is very good. And with that, if you do 3 days weekly body weight training, plus you, depending on your goals, have a caloric deficit and do a mobility routine daily of 10 minutes, I think it's ample for a lot of senior citizens to have good amount of fitness.
Yes.
There is a very interesting question for the panel that आज doctors हैं, emergency है, night time में there are a lot of people who have night time duties. So what kind of fitness regimens or how can they take care of their fitness goals? So answer question to all the panelists.
Any time is good time, provided you do it. Anytime.
Right.
Yeah.
So what is your time for exercise? I mean, you are a busy practitioner. So when do you set your time? How do you set your time?
It's the first thing in morning.
Okay, sir.
And having said that, I will add one more thing. We have got a very interesting discussion. Like I said, it is a genetic kind of thing. Huh? You are not getting able to wake up in the morning. And even if those who are having the evening or night duties, they can have some like their rhythm and their this sleep rhythm is always changed like that. And they can have any time 30 minutes of a day, 24 hours में 24 घंटे में 30 मिनट निकालो, and you can finish your workout. Only I said Surya Namaskar. Surya Namaskar. That's it. More than enough.
Yes.
Anything, anytime is good.
Tejas.
Yes, sir.
This is regarding those people who is asking question about night duty. Now we take an example of an air hostess. She flies for 14 hours, 16 hours. Her sleep is disturbed, jet lag, because they are not immune from jet lag, but still they keep fit. And if they do not keep fit, they are out of the job. So if it is possible for an air hostess to keep fit and earn from it, it's not impossible for anybody who is having night duty.
Right, sir. Point well taken, sir. Point well taken. Mudakar sir, before we go to our talk, if we have a permission, we have one last question for the panel. Is it okay?
Yes.
So I'll ask this question to my fellow orthopedic surgeon and dear friend Ashu. There's a question that if you have bad knees, how will you, what are the exercises that can be done? And what, like say even walking and running, these are not possible for bad knees. So आप कौन सी exercises suggest करोगे उनको?
See, bad knees means Tejas, patient might have gone for a TKR and all, or maybe having some restricted movements in knees. So as I have already said, strength and other exercises can be done without actively flexing the knees also. There are n number of exercises. So he or she can definitely go have a good training session, judge what she or he can do with this knees, and have a good exercises. Cardio, yes, on elliptical and all, they can do without actually bending the knees. So this is the one part. Second thing, as we have already discussed the other part of exercises also, the modification changes needed in special population that can be done, and n number of exercises for bad knees are available on Google also. You can very well search and do that exercise. See, doing something than not doing at all is beneficial to see obese lady who is having osteoarthritis and all. We come to in OPD also, many people say, Doctor, माझा वजन एवढा आहे, मी काहीच करू शकत नाही. So recommend them other exercises so they can do it. As we were talking about genes, some people say obesity run in our family, but fact is no one runs in the family. That's why obesity is there.
Right.
So start doing something rather than giving explanations.
Yeah.
Be more than your excuses.
Yeah.
Agree.
I would also like to add a comment on bad knees. What generally happens is you have to break the pain cycle. What we as knee specialists describe is that pain is when there is pain, there are inflammatory markers. Like for all of us doctors, there are increased levels of inflammatory markers in the joint. And if you go beyond that pain, that means no pain, no gain is something that, probably these gym guys will tell you. But I personally feel that that's a very wrong mythology to be answering and to be, privy to. What I believe is if the patient has pain or if we have pain, we should stop that exercise their time itself. So do what is pain-free and be consistent and gradually increase that exercise. And so for anyone who has bad knees, if you cannot do a full squat, start with squats on the chair. Prefer closed chain exercises. What I mean by closed chain is where your feet are touching the ground. So a straight leg raise exercise for the quadriceps is not very good compared to a half squat, which is a closed chain exercise. So work on that. Work on making the hamstrings and quadriceps more mobile. When you have increased leverage of the muscle, this will give you good range of movement. This will decrease the pressure on the joint and this will decrease the pain. And I think these probably basic mantras can definitely help. So I will ask Parag Dabre sir now to introduce our star speaker.
Yeah, Tejas. After Sachin Tendulkar, I'm asking our Rahul Dravid of our IMA. I'll introduce Prashant Mulwakar sir, though he doesn't require any introduction to the IMA guys in Akola, but we have a lot of audience from all over India. So he is MBBS DGO, and then he did his MS General Surgery, DNB General Surgery, MCH Urology, DNB Urology, and one more feather in his cap is he has done his Chirurgery Masters from Edinburgh. And he is a consultant urologist and andrologist. He is honorary secretary of Urological Society of India, West Zone. He is a tutor in urology at University of Edinburgh, UK. And he is on the reviewer panel of 10 international journals and 20 publications. He is an avid endurance sport athlete. He runs more than 30 marathon runs, half marathon and full marathon, including everything. And he is an Ironman 70.3 finisher also in a team event. He has motivated many people, including me, in the endurance sport. And above all, he is a very good speaker. So over to you, Prashant sir.
Yeah, I think my slides are visible.
Yes, sir.
And I'm visible, I'm audible. Friends,
Yes.
You have had talks which were scientific, technical, evidence-based. Now, whatever you're going to see, listen, hear is not scientific, not evidence-based, but experience-based. And it is my journey. That means it's a story. It's a story, which I'm going to tell maybe in next 20 minutes. Before I start my story, this story is possible only because of cooperation from my family. You will see so many photographs of my family here. And in only one photograph I'm seen, because whenever they are clicking the photograph, either I am clicking them or I'm running. So tribute and thanks to my family for being with me. There are no conflict of interest. Friends, I have got infinite buddies. Hundreds and thousands of people have inspired me, and it is not possible for me to name everyone. And if you do not find your name or photograph in this presentation, please excuse me. You don't have to be great to start, but you have to start to be great. You have to start someday. You have to start. My motivation for my marathon journey is my teacher, Dr. Parsijal Chibbar. He's running this marathon in 2008, and you see his bib number. It is written senior veteran. That means at that time he was more than 60 years. So a man who is more than 60 years is running a half marathon. That time I was something around 40 years, and I said that if he can run it, I can do it. The outline of my talk, I'm going to have 9 sections of this talk. How did I start? How did I motivate the people? How do I manage time? Because everyone asks me, how do I manage time? Why should one run a marathon? And the main part of that is the storytelling. Then I'm going to speak something on IMA walkathon experiment. What do I do now? And other 2 parts of the talk. Coming to the first thing, how did it start? 1993, when I got married, my weight was 40 kg, 40. 96, kept on eating, weight is 60 kg. 2000, I had my second daughter, my weight was 70 kg. And 2004, when I had my third son born, my weight was 75 kg. So deliveries do not increase the weight of ladies, they increase the weight of gents also. That's the living example in front of you. My weight was 75 kg, and I had a huge practice. I used to work 14 hours a day. My weight was 75 kg. I used to snore in night, and one night I had an arrhythmia, supraventricular tachycardia. I had a syncope, arrhythmia. I went through that Holter monitoring and so many things. At that point of time, my situation was, इतने हिस्सों में बट गया हूं मैं, मेरे हिस्से में कुछ बचा ही नहीं. मैं सिर्फ दुनिया के काम करता था, लोगों के काम करता था, प्रैक्टिस करता था, इसका काम कर, ये हॉस्पिटल में जा, वो हॉस्पिटल में जा, ये कॉल देख, वो कॉल देख, ये आर्टिकल पढ़, वो आर्टिकल पढ़, सब करते करते मेरे हिस्से में मेरा खुद का कुछ भी बचा नहीं. And at that point of time, I thought that I should break free from this routine, and I got these friends जिनके साथ मैंने जिंदगी का पहला दौड़ना चालू किया. ये सब मेरे से उम्र में बड़े थे और इनके साथ मैं दौड़ता था. ऑफ कोर्स इनके साथ में मैं दौड़ता था, मैं उम्र में सबसे छोटा था, तो धीरे धीरे मुझे ऐसे लगने लगा कि मैं शायद इनसे ज्यादा दौड़ सकूंगा. In addition to that, there is a highly motivational group called Jai Sri Ram group, and they used to have Akola to Gaigaon trip once in a year. You have to run or walk for at least 10 kilometers or 15 kilometers. I joined that group, and from these 2 groups, I got an inspiration that yes, I have to run, walk, exercise. Second part of my talk, how did I motivate people? टागोर साहब क्या कहते हैं? যদি তোর ডাক শুনে সে কেউ না আসে তবে একলা चलो रे. मैं टागोर साहब के साथ बिल्कुल सहमत नहीं हूं. एकला नहीं चलना है भाई. मैं जो भी करूंगा लोगों के साथ करूंगा. मैं लोगों को साथ में लूंगा, उनको उठाऊंगा, गाड़ी में बिठाऊंगा, गाड़ी में डालूंगा, लेके जाऊंगा, आऊंगा उसके बाद. सो ये सब कैसा है? हाउ आर द हैबिट्स फॉर्म? फर्स्ट थिंग इज मेक इट ऑब्वियस, make people crave for it, to make it attractive, make it easy, and then you give them a reward that yes, you have done it. This is how the habits are formed, and this is how you will work. So I got people who had low ability, low motivation. I motivated them, and they had a high ability. And then I told him, now you wake up, you can perform better. Friends, the target that was given to all my friends was very simple. You have to run more than 5 kilometers twice a week, that is Thursday and Sunday. Only this thing. So we started that, and it is not luck. Now this is the graph of performance. On x-axis you see motivation, 0 to 100. On y-axis you have motivation. On x-axis you have ability. So as your ability increases and your mobility, your motivation increases, you have increased likeliness to perform better. And in this graph, you will see three kinds of people. Type 1, who are highly motivated, mere jaise, but low ability. Type 2, high ability, but low motivation. Many people. ये दोनों को ट्रांसफॉर्म करने का है group 3, that is high motivation and high ability. That was my aim. And I got people who said, no, I do not want to take this size. क्या करना यार, मैराथन दौड़ के बहुत हो गया ना, अभी ठीक है, वजन अच्छा है, कोई इशू नहीं है. लेकिन इनको मैंने जब ट्रांसफॉर्म किया तो कहते यहाँ मुझे आना है, आपके साथ आना है, मेरे लिए रजिस्टर करो, मैं तेरे से अच्छा करूंगा, मैं मेरे खुद से अच्छा करूंगा. तो ये सब कैसे होता था? मैं लोगों को सवेरे उठाता था, उसको गाड़ी में डालता था, पिकअप करता था, उसके बाद में हम पिके भी जाते थे, वी यूज्ड टू रन. ये सब होने के बाद में सब कार्यक्रम 3-4 महीने चलता था. उसके बाद मैं खुद सबको मेरे पैसे से रजिस्टर करता. ऑफकोर्स पैसे सबसे लेता था, मैं उनको मैराथन में रजिस्टर करता था, उनके सबके ट्रेन के टिकट बुक करता था, उनका मुंबई में का अकोमोडेशन बुक करता था, और उसके बाद में ये सबको गाड़ी में डाल के पकड़ के मुंबई में मैराथन दौड़ाता था. ये सच है. ये सब सर्कल करते करते मैं उनको मोटिवेशनल पोस्टर भेजता था. ये एक पोस्टर है जो फौजा सिंह का है, एक पोस्टर है जो विल्मा रोडोल्फ का है, जिसको पोलियो हुआ था, and then she ran a marathon. ये अब्राहम लिंकन है, who had lost so many elections and then became the president of USA. इनको सबको मोटिवेट करता था, और ये सब करने के बाद में उसको बोलता, चल भैया, सफर में धूप तो होगी, जो चल सके तो चलो, सभी है भीड़ में, तुम भी निकल सको तो चलो. बिकॉज बाय दैट टाइम दे वर सो मोटिवेटेड दैट दे यूज्ड टू डू एवरीथिंग ऑन देयर ओन. ये मेरा एंड पॉइंट था मोटिवेशन का. सो आई कम टू द नेक्स्ट पार्ट ऑफ माय टॉक, टाइम कैसे मैनेज करने का. दोस्तों, टाइम बहुत सिंपल है. समय के पास इतना समय नहीं है कि आपको दोबारा समय दे सके, और आपके पास उतना ही समय है जितना एक महान और सफल व्यक्ति को मिलता है. मतलब आपको समय निकालना पड़ेगा. हाउ? You set your goals properly. You prioritize your activities. You set a time limit that yes, I'm going to do this in 30 minutes. I'm going to do this in 40 minutes. You take breaks in between the work. Organize your work. Delegate some responsibilities and remove all non-essential tasks. कि आज खाने में क्या बनना है, क्या नहीं बनना है, कुछ नहीं करने. टीवी देखना जरूरी नहीं है. And plan your activities. With this circle of time management, you can find time for anything. That was the part 3. Part 4, why should I run a marathon? Why this photo is there? Because it's written run for a reason. There should be a reason why you should be running a marathon. Marathon is such a challenge that you will never ever forget in your lifetime. Never forget. And it's pretty cool to drop you into conversation with anybody that I have run a marathon. Moreover, it's a part of mass participation activity. You will see thousands of people who are running with you. Everybody will motivate you to perform better. And this is a photograph from New Jersey Marathon, USA, where I was running. You see, these 3 people, disabled people or differently abled people, are running on tricycles. They were running a marathon on tricycle with we people. So if such people are there who can run a marathon or tricycle the marathon, why it's not possible for you? It's possible. And once you have done this, almost everybody in the town will know you and they will get inspired. His name is Mr. Vihan. He recognized me. अरे आप मुड़ावकर सर है, आपके साथ फोटो लेना है, आपने मैराथन दौड़ी है. So you will get so many people who will recognize you. And once you run a marathon, it gives a totally different level of confidence which cannot be described. Moreover, Mumbai Marathon is such a place that you get a huge crowd and all crowd is motivating you. They motivate you to run better. Also, marathon is a opportunity to raise money, although I do not do that part of marathon. Friends, the moment you cross a finishing line of marathon, that moment will live with you forever. You will always remember what was happening. And once you cross the marathon finish line, you will always be the one. No one can take you the title from you. Gundu Rao was the Chief Minister of Karnataka. He said, I am the ex-Chief Minister of Karnataka. Nobody can take this title from me. So I can always say, yes, I am a marathon finisher. Secondly, and most important, a person who starts a marathon is not the same person who finishes a marathon. Once you have finished a marathon, you are a totally different person. There is a lot of time management, lot of strength management, lot of exercise, lot of planning. Everything goes into running a marathon. So you are a totally organized person. And friends, prizes, t-shirts, medals, everything. Everybody likes it. Everybody likes it. एक बात और है, सबको ऐसा लगता है यार मैं जिंदगी में एक बार मैराथन दौड़ूं. सबका वो पॉसिबल नहीं होता है. सबके बकेट लिस्ट में होता है यार एक बार मैं करूं. आपसे होता है, आप करो, क्योंकि आपसे होता है. So that's why I should run a marathon. Now I am coming to the main part of my talk, that is the storytelling. Marathons that I have run, I will try to be as short as possible. 13 minutes are over. 2009, we ran our first marathon, and these were the guys who ran that marathon. We were all very high in morale, everybody enthusiastic, extremely satisfying marathon. Everybody who came from that marathon said that, yes, we are going to come again. And next year, and this year, this was the photograph, group photograph we took in Akola. That event was covered in all newspapers of Akola. And next year, we had around more than 20 people running a marathon. More than 20 people. See Dr. Anita Khandelwal, Deepak Mai, Govind Khandelwal, so many people. And these are some of our photographs. Dr. Mrs. Garge, Ravi Singhi, Vinit Hingankar. So many people joined our, and we got this photograph. In 2010, my teacher, Dr. Percy Jal Chibbar, who has inspired me to run a marathon, met me in the marathon course and inspired me. 2010, again, we went to Singapore. Most of the same guys, few additions, and it was a very good experience to run in Singapore. Only thing is the weather was not so good. 2011, we ran again Mumbai Marathon, and this time more than 25 people participated from Akola. In 2011, again, I went to New Jersey in USA, where I ran a half marathon. And because of this Indian flag on my chest, whosoever were Indian were encouraging me and were saying, hey, India, come on, India, come on, India. So that particular thing makes you perform better. Now, it is a dream of any marathon runner to go to the city of marathon, which is in Greece. And from that city of marathon, there is a marathon. The end point is in Athens, and that's the 42 kilometers. So marathon starts from this tomb of marathon soldiers, and we had been to that place. This is the marathon flame, which is yet to be lit. We visited that spot and we ran. This was the team, and this was the Pantheonic Stadium where the first modern Olympic Games were held, and we are running a marathon. This is the finish point of the marathon. in the Athens city. Friends, the temperature that was there at the start of the marathon was 4 degrees. And when we finished the marathon, it was 8 degrees. But it is possible to run 42 kilometers in that temperature also. 2012, by this time, our marathon running became so popular that even the many people from Akola used to come to railway station to see us, to greet us, to congratulate us, and to promote us. Many people joined us, and after that, after the 2012 Mumbai marathon, we ran a Delhi marathon, but the weather here was very horrible. Everybody except Parag and Ravi Singhi had good times. But anyway, it was a good experience. 2013, this photograph of Vinith Hingankar was published on a front page of Maharashtra Times as a marathon runner. In 2013, I went to Canberra, that is the capital city of Australia, and I ran this marathon. This was the best time that I have got on a road marathon, that is 2 hours 29 minutes. I could not beat that time any time after that. And 2013 again, we went to Nairobi, Kenya, where we ran a standard charter marathon. Vinith Hingarkar, Ashish Dabre, Rajendra Sonon, and so many people. We ran with Indian flag, and we were greeted by the crowd. 2014, again, most of our team members ran a Mumbai marathon. And in 2014, I went to Port Elizabeth, that is in South Africa, to run a Port Elizabeth marathon. This was a full marathon. This was again a very nicely organized marathon. They had got good support system. And there are our photographs from 2015. See how Parag is joyous. Even Pankaj Jaju joined us. He had a very good time in this marathon. 2016, I had a horrible time in marathon. I think I finished this marathon in 3 hours 20 minutes, which was the poorest time I have ever recorded in marathon. I was disqualified from marathon. So to qualify for that marathon, I had planned that I will run this marathon, other marathon. But because of my father's illness, I could not run any marathon. At that time, Dr. Parag Dabre came to my rescue, and somehow I qualified for the marathon because of lot of help received from Parag Dabre. After that, we ran this Aurangabad marathon. It was a 25-kilometer marathon in the Ellora Caves. That was the turning point for this marathon. 2017, because of qualification, I ran the Mumbai marathon. I had a very good time. And 2017, we thought that why this? Let us run a marathon on the Arctic Circle, that is Finland, Rovaniemi, a land where you can find a midnight sun. Now this marathon started at 2:30 p.m. Can you imagine a marathon starting at 2:30 p.m.? We were just curious how can a marathon start at 2:30 p.m. When we reached there, we found that it's a 24-hour daylight. It doesn't matter whether it's 2:30 p.m. or 6 p.m. or 2 p.m. Doesn't matter at all. So 2:30 p.m. the temperatures were around 10 to 12 degrees, because that's the somewhat hottest time of a day for that land. After that, we ran, this is again to a Mumbai marathon. See how Parag has toned up his body and how joyous he is by running the marathons, and he has bettered that. And another advantage of running a marathon, you get so many friends. This is a lady from Mumbai. She is a physiotherapist. Met me on the course of Amravati marathon, and we just were talking and running. And she said, why not have a photograph with you? Yes, why not? So that's how you get new friends. 2018, I ran a Mumbai Nagpur marathon, but this was not a properly organized marathon. Probably they have improved a lot. Next time we'll go to Nagpur. Maybe we'll find a better organization. Now 2019, why this center photo is there? I have been persuading Parag as well as Archana to run a marathon. Parag immediately agreed, but she took at least 8 years to say yes. And at the end of 8 years, she said, I will run 10 kilometers. I said, yes, no problem. You run 10 kilometers, but run. Now, she has a time better than me. गुरु गुड़ रह गए, चेले शक्कर बन गए. That's why this photo is there. Again, we had a 19 marathon in Akola. Now this photograph, this marathon, the temperature was 0 degree. Temperature was 0 degree. This was Greenwich, London, 2019, 0 degree. And yes, 2020, this is the last Mumbai marathon we have run. After that, this was a virtual marathon, Comrades, again a virtual marathon. And these were the around 30 marathons we have run so far. That brings me to the next section, walkathon. My philosophy is एकला चलो बे ना, एकला ना चलो बे, सबको साथ में लेके चलना है. So we formed this IMA walkathon group and we started this activity in 2008. So many people, thousands of people in Akola used to run on street, see the people, thousands of people, and they used to greet us. They used to run, they used to enjoy. Somebody will do a fancy dress, somebody will do some other statue, somebody. This is Chetan Chauhan in Akola. He was the opening batsman for Indian cricket team. And this was the first time a test cricketer came to Akola because of walkathon. Chetan Chauhan giving away the prizes for walkathon. Boys posing for fancy dress in different attires. All the press, all the media, all the officers, all the clubs, so many social organizations in Akola joined IMA walkathon and participated in the walkathon. And he's Mr. Gopal Saini. He's the Olympian from India, steeplechase champion from India, Gopal Saini. Again, thousands of people. The highest point for IMA walkathon was when Milkha Singh personally came to Akola and greeted all of us. I ran the project of walkathon for around 10 years, and after that I gave away that activity to my colleagues. Now what do I do now? I am 56 years age. Most of my journey so far was not with science, but only with heart, only with desire to run, and with some inputs from people like Parag who used to know. मैं तो पढ़ता नहीं, क्योंकि मुझे मेरा पढ़ने पढ़ते ही मैं परेशान हो जाता, तो मैं कहाँ से रनिंग के एक्सरसाइज के बारे में कुछ भी पढ़ने का नहीं. आई यूज्ड टू गो टू जिम, आई यूज्ड टू रन, आई यूज्ड टू साइकिल, व्हाटएवर इज पॉसिबल, जो भी होता था मैं कर लेता था. व्हाटएवर इनपुट्स आई यूज्ड टू गेट फ्रॉम Parag, आई यूज्ड टू absorb those. But the most of the inputs that I follow nowadays is from tutor. He is Amit Samarth. He is the cyclist, and if I start describing Amit Samarth, it will take at least 5 minutes more. So you can Google about him. He is my tutor and I'm following him. एक चीज मैं चाहता हूं, I want to pass the baton of this social responsibility that people in the city of Akola should run, walk, cycle, jog. ये सबको मोटिवेट करना किसी ने अभी करना चाहिए. मेरे लिए अभी पॉसिबल नहीं है. The priorities in my life have changed somewhat. It's not that I'm getting very old, but my priorities have changed, and I want to pass this baton to somebody who will take over this task. और एक चीज जो मेरे बकेट लिस्ट में अभी बाकी है, जो करना है, जो तमन्ना है, जो मेरे साथ में अगर कोई आ सकता है तो मैं कर सकता हूं, और वो है अंटार्कटिका मैराथन. दोस्तों, अंटार्कटिका में भी मैराथन होती है और वो पॉसिबल है. Anybody amongst us wants to come with me, I'll be happy to join. So, दोस्तों, कल दौड़ेंगे? कम से कम वो चैट बॉक्स में यस डाल दीजिएगा.
Yes, sir.
Thank you.
Yeah, excellent talk, sir. Beautiful and very inspiring talk. You have covered the entire journey of Akola endurance athletic activity, and you are what I can call is a guru or Pitamaha, Vishnu Pitamaha of our endurance community. We really appreciate your wholehearted support, and it was you. Because of that, we all are in the endurance activities and doing all sort of activities. We really, from IMA Akola, we all really appreciate and will really thank you from bottom of our heart. What do you say, Tejas?
Sir, I mean, you couldn't have summed it better. Sir is like the epitome of oratory skills, and he always inspires each and every one of us, including me, to become a better orator, to talk with such clarity of mind, and have beautiful thoughts which can be portrayed and can relate to each and every one of us. I really loved the Satara Marathon photograph as well of Sir. It was really good. Sir, it's my responsibility to ask you a question, because the question has been put up on the board. That what was the age? I know you don't like us talking about your age, but what was the age at which you started running, exercising, and doing your endurance sport?
I think it was around 40 years. 40
Our
years.
age, right, sir?
Yeah, 40 years.
That's truly inspiring, sir. Truly inspiring. Thank you so much.
Thank
you. Any other questions that anyone would like to ask or would like to share a comment on? Dabre sir, your experience of so much endurance sport and strength training, Dabre, Ashu.
Just Prashant
go
sir
ahead.
is,
Ashu, go ahead.
sorry, sir.
No, go ahead. Please go ahead.
Prashant sir is, means sir has described him very well. Like he is Bhishma Pitama. He has motivated all of us to participate in marathon. And we are, sir is the first person you will find on the ground wearing his shoes and becoming ready for running a marathon. We did a Bangalore marathon, also virtual edition. Sir took an excellent efforts. And sir, I can assure you, we can just continue your battle, but you have to be there. You have to be there for Akola. You have to be there for us. And as you all know, Bhishma Pitamahala the Vardhan hota, sir. Ichha Maran, sir. So don't leave us like that. And don't do a Bhishma Pratigya also, that you will be leaving the marathon.
No, I'm not leaving the marathon.
Yes, we will run. We will run together.
I will be running the marathon. I just wanted that the job of inspiring people.
Yes, sir. We'll definitely continue.
So many people, and it's not possible for me to reach out to so many people.
Yes,
because there are many people.
Yes, sir. We will definitely continue that.
Yeah, I like to add that this is one of the efforts like to start a CME on this particular topic. And really thanks Tejas and entire team, IMA Akola. We thought of this particular CME, and it has a two part. One part is today and one part is next weekend. And it will really motivate a lot of people and give us the insights what's happening in the exercise arena. I think one more question to Prashant sir is how much weight he lost. That is what somebody has asked you, sir.
12 kg.
Great.
12 kg.
Nice. Yeah. So there's one more Q&A for, I think, for Dabre sir as well as Mudavkar sir, that how do you acclimatize to such extreme weather? Like we saw in Mudavkar sir's photographs that you have been traveling all around the world. And now you plan to go to Antarctica, which is like extreme weather. So how do you acclimatize to these conditions for the benefit of our...
Yes, Tejas. See, my photograph of that Greenwich Marathon in 0 degree, I'm wearing just inners. On that, I'm just wearing a normal shirt. And my hands are covered with just some sleeves. Once you run a half a kilometer, your body becomes so hot that you will try to throw away those clothes.
Right.
You acclimatize just within 5 to 10 minutes. And you have to do a proper, I'm not getting that word.
Warm
up. Yes, proper warm up. Just do a proper warm up. For this marathon, actually, I went to that place in a metro train. So I started my warm up in metro. Just I'm doing this. So by the time you come out of the metro, although the temperature outside is 0, your body is warm. You rush you rush to the start point, just get a bib and start running.
Right, sir.
Yeah, can I add one more thing, small thing? See,
sir, please.
regarding how do acclimatize and how do you start? See, this marathon or Ironman is not entirely a physical game. Okay, it's not. After some time, you hit the wall. We all have experienced as an endurance athlete. After that, hitting the wall, there is a psychological one wall. After that, your body is entirely थकलेला असता तुम्ही. You cannot lift your leg. तुम्ही चालू शकत नाही. Then your mind start working. For 7 hours, for 5 hours, if you are doing these activities, like in Ironman also, it will teaches you a lot of things: mind management, your body management, everything, your food management, nutrition management. So everything is in your mind after particular point of time, including acclimatization to the मुझे एकदम ठंडा वेदर. अभी तो सर अंटार्कटिका की बात कर रहे हैं, अपने को तो यहाँ पे सुन के ही अभी ठंडी लग रही है यार. वहां पे 0 से भी नीचे टेम्परेचर रहेगा, कैसा होगा?
तेरे को लेके जाऊंगा.
It will happen. So no question about it. So it's very interesting. And अगर interesting activity हो, मन से करना है, बहुत उसमें involved हो, तो जो भी obstacles है होता है. But this is a valid question for the novice and the people who have not done it. एक बार करने के बाद में लगता है कि वो समुद्र पे कैसा तैरना होगा, ओपन वाटर स्विमिंग कैसा होगा आयरनमैन में. लेकिन now I'm confident that I can swim in any kind of choppy water in Goa to एकदम संथ वॉटर जिथे आहे तिथे समजा तिथे पण पोहता येईल, किंवा एनी फ्लोइंग वॉटर, नॉन फ्लोइंग वॉटर. ओपन वॉटर स्विमिंग इज अनदर big some different ball game. But anyway, that can happen definitely. And I think I have seen a comment from one person, Ms. Vidya ma'am, that yes, I will definitely start running from today. That our aim is now fulfilled. At least one person has said that I will start. That's it.
The last word is today, not tomorrow.
Yes, that is what she has written.
Vidya, today.
Great. Anand sir has written, I will run today as well. Great.
Yes,
Great.
good.
Very nice. Very nice.
We have done some justice.
I'd just like to add just one
Yes,
or two things. Now, this concept of this thing is, there are two parts. One is your body, one is your mind. Suppose I am running a full marathon. My body usually gets tired at around 30 to 35 kilometers. So at up to 35 kilometers, I am able to run without getting tired. And that's the normal glycogen storage capacity of any individual, that yes, around 35 hours, he will hit the wall. Now, if I am running a half marathon, my body gets tired at 18 kilometers. If I am running a 10K, my body gets tired at 8.5 kilometers. And if I am running a 5K, I feel tired at 4 kilometers. So this is all in the mind. All in the mind. If I have taken this thing that I am going to running 10K today, I'll get tired at 9 kilometers. So it is mind.
Yeah.
So
Absolutely, sir.
don't get tired by mind.
So I think mental training and mental health is also a very important aspect of fitness. And that's why in our webinar series, in the part 2 of the series, we have another star speaker who would be talking on mental health, which is, Dr. Deepak Kedkar sir, who has more than 1 million followers on YouTube. And he will be talking about mental health. And I think you have hit the nail on the head when you said that any fitness journey requires a very strong and stable mind. And it's all in the mind. Definitely, sir. That's a very good take-home message. There is one last interesting question, I think, for strength training. Dr. Ashutosh must be thinking that we are only talking about marathons. So, Ashu, you have a question that if a person starts at the age of 60, will it lead to a muscle mass increase? Because we know that there are hormonal imbalances, the T levels, as the bodybuilders call it, and the sports science calls it, or for the uninitiated is the testosterone levels, they dip significantly. So what is your take on senior citizens starting strength training?
Age is just number, as they say. And strength training, there is no age bar as such. The person starting at 60 will not look like Arnold definitely, but he will be a better person after say year or 2 years. So all hormones start means testosterone and all in gents. It will start accumulating when you start strength training and all. So your goal will be realistic, should be realistic goals. See, suppose we have a decent group on Facebook also for doctor fitness and all. There are many people who are 60 plus and having muscular body. They are maintaining their strength and they are doing excellent than any 16-year-old kid. So it's not about age. It's just a matter of starting it.
Ashutosh,
Yes, sir.
I just want to add some statistics to it.
Yes, sir.
I had a mention about Fauja Singh in my presentation.
Yes.
Fauja Singh ran his first marathon at the age of 89 years. First marathon
Yes.
at the age of 89 year in year 2000.
Yes.
So if a
Wow.
89-year man can start running marathon, it's not impossible.
Yes. 60 is too early to start.
It is too early.
Yeah.
60.
Great.
Sir, they say don't worry about getting old. Worry about thinking old.
Yeah.
When you stop thinking about getting old, you start becoming younger and younger day by day. So age is just a number.
So I think Tejas, we
Yes,
have taken more time of weekend of all the people who are
Yes, sir.
enthusiastic. And towards the end also we have got a full house. And
Yes.
one announcement that we have got a recording of this entire thing, and definitely with the permission of the IMA Akola, we'll put it on YouTube or whatever channel we have. So any concluding remark, Tejas, and then we'll
Sir,
finish.
I would just like to say that, yes, as you said, that this whole webinar would be available on YouTube on the DigiShield channel and also on the DigiShield app. And I think today we had, if for the younger generation, this was the Avengers or the superheroes of Akola Fitness that we managed to get. And it was my privilege to be, as the secretary of IMA and as the coordinators, to have first and foremost Muralkar sir, then Dabre sir, and my dear friend Ashu, who could enlighten each and everyone. And it was a very enlightening and inspiring session for me personally, because I am not a runner, but after I heard both of you all talk about it, it has enlightened, and I think I should also be saying that I'll be running from today and not from tomorrow. So thanks to each and everyone. I would also like to thank our president, Dr. Mahendra Kardasar, who gave me this opportunity. It was a dream of mine to have a fitness related CME which covers almost maximal aspects, and he gave me full liberty of choosing the speakers as well as getting the platform. I would also like to thank the tech team, including Mr. Mehta and Mr. Piyush from DigiShield, for doing a wonderful job for all of us. And with this, I think we can conclude the CME. And thank you each and everyone. Thank you so much.
Just the DigiShield person has put a link on the this thing in a chat box. They can
Right, sir.
click and see the thing. So thank
Right,
you, thanks a lot.
Thank you very much. Thank you, everyone.
Thank you.
Yeah, be part. Thank you.